Robotic surgery is an extension of keyhole surgery. In this robotic operation, we insert the cannulas inside the abdomen and we connect the instruments with the robotic arms, and these robotic arms then controlled by the surgeon all the time continuously through a console in which a consultant, a doctor, sits. After all the robotic arms are docked in, the view is extremely sharp because a 3D view in which consultant can see the inside details of the abdomen very much in detail as compared to laparoscopic or conventional keyhole surgery. Once the disease is seen, then these instruments have scissors like to cut things, something to hold and something to stop the bleeding. With these few instruments then, we're able to excise all the endometriosis from inside while we have a full view. If there is ever any problem, then this robotic system can be undocked immediately and a consultant can come back to the patient and then can manage it effectively if there is a problem. At the end of the surgery, we take all the instruments out and we close the abdominal wounds with the normal stitches. In robotic surgery, the vision is a critical part. Because robotic surgery gives a 3D view, you have a much better depth perception. So I'm able to see structures such as ureters, bowel, even small nerves much clearly than a conventional laparoscopic surgery. Then in one hand I can hold the tissue which needs to be removed, and with the scissor you can go on to excise all the endometriosis around that tissue, millimeter by millimeter, in much more detail and precision what conventionally we do. The robotic view allows me to see the smaller nerves much more clearly, and what we call it now nerve sparing injury. Nerves are very important. They supply different structures of the body. They also control different functions. By trying to spare these nerves with a much better view with 3D vision in robotic system, it helps to reduce any post-operative complication. So with this precision and the view of robotic surgery, we can then try to do surgery in a much safer and a better way as compared to conventional laparoscopic surgery. There's a team which helps in executing all these steps in the operation. While a surgeon is sitting in the console and doing the surgical bits, we have an assistant who is standing with the patient all the time to move the instrument, to insert the instruments inside and to remove them if that need be. There's also someone, a theatre nurse, assisting the assistant, and then we have someone sitting in the pelvic area to move the uterus. So actually it's a team which comes together to do this operation. So while surgeon is operating safely on one side, you have an assistant who are along with the patient all the time and making sure that patient is safe all the time. And if anything needs to be done, they're immediately able to do it as well.